how do you categorize, like, let's say a person, if they like in is there such thing as like a stages of, like, having a poor mental health? How do you assess it? What's your process like when you assess somebody who's dealing with some mental illness or mental health problems? How do you assess it or something?
Sure. We follow the DSM 5 guidelines.
Uh-huh.
So that's the Diagnostic Statistical Manual of Mental Health Disorders.
Mm-hmm.
And basically, what we see in our patients that we do like typical questionnaires like PHQ-9 for depression
Mm-hmm.
and also GAD-7 for anxiety.
Mm-hmm.
And then we ask those criterias or how they're functioning in terms of their sleep, appetite,
Mm-hmm.
their ADLs, and
Mm-hmm.
also how are they functioning at work. Have they
Mm-hmm.
noticed anything unusual about their movement?
Mm-hmm.
Have they noticed any trouble with their focus or concentration? Or I always tell my patient, have you ever felt that your brain is playing tricks on you, that you tend to hear some voices, or you tend to think that you want to hurt yourself or other people, which are pretty much risk assessment.
Mm-hmm.
And how do they feel about this pandemic
Mm-hmm.
sense of social isolation?
Mm-hmm.
How are they coping?
Mm-hmm.
Do they have the support? And do they always are they aware of what's going on to them and
Surroundings, right? So
surroundings?
how do they like, let's say you mentioned earlier that
Mhm.
self-care, right?
Yeah.
Now, I guess maybe the viewers out there who's watching this episode about mental health, how do they uh do the self-care if they're at home where there's like a lot of tensions or stress going on? How do you
Yeah.
deal with that, or what's your suggestion? What do you suggest to them?
Sure. I tell my patients they have to put some boundaries, like a time for themselves. So if
Mm,
they have kids, like they wake up at 6 a.m., probably will
mm,
be wise for the parents to at least make like an adjustment of their time instead of them waking up also at the time that the kids are up. I always tell my patient to be an early riser to at least set
yes.
time for themselves. Just having the me time is really important for a
Yes.
lot of my patients, and then that me time will actually make an impact in how they progress and handle their stressors. But it's case to case basis. But I find it very beneficial that if a patient takes time to take care of themselves and they have their me time
Mhm.
or self care time, it creates a different impact to them and
Yes.
especially
Actually,
improves the mental health.
you know what?
Uh,
I believe that because
mhm,
I've done it actually. I mean, yeah, I this past few, yeah, because like I've took like 3 weeks off in doing the show, right? So what I did is like I tried to assess myself because definitely I'm affected with the stress, right, of what's going on with the pandemic. So what I did, well, like you mentioned,
mhm.
I adjusted my routine. I adjusted my time. Believe it or not, I'm waking up 3 o'clock in the morning.
Wow.
Yes.
Yes.
Then because I guess maybe like it's like the mental thing that I kind of like rewired my thinking. Like I gotta make this happen.
Mhm.
I gotta wake up early. I am very productive actually. I finished a lot. Like we were like talking earlier, I mentioned to you that I'm about to launch my software,
Right.
right?
Yes.
And
Congratulations.
because, yeah, I mean, I'm about to do that. And because of that, I adjusted my thing. Because if I wake up, like you mentioned,
Mhm.
if you wake up the same time as your kids, it's going to be like stressed.
Mhm.
Your day is going to be like, I've experienced that.
Mhm.
And definitely my wife experienced it because we're in the same house, right? So when I did that, it's really remarkable that you mentioned that how exactly the same thing that I did, became more I guess my mind is clearer.
Mhm.
You tend to like think much faster, productive, and everything, and it helps me. So now you can during the rest of the day, although I do take naps
Mhm.
like after lunch
Mhm.
because I'm like really sleepy.
So
3 o'clock in the morning, then you're up until 1 o'clock is like almost like 10 hours,
10
right?
hours.
So you tend to get tired. But again, that's the difference that happened to me.